You're listening Farmer Knowledge audio tracks. Please subscribe and click bell icon for increase your farmer knowledge.
Quality risk management within the pharmaceutical industry. Every product or process has associated risks. Zero risk reduction is not a realistic goal. Nevertheless, protection of patient by managing this risk in the quality system and manufacturing process is being given prime importance in the pharmaceutical industry. It is important that product quality should be maintained throughout the product life cycle. In the earlier days, risk was assessed in the following ways: trends review, checklists, flowcharts, observations compilation, changes review. Now the risk management approach initiated by regulatory agencies with recognized management tools along with support of statistical tools are implemented across the industry. Risk management is a systematic process for the assessment, control, communication and review of risks. A risk management program starts with identifying the possible risks associated with a product or with the process used to develop, manufacture, and distribute the product. An effective quality risk management process ensures the high quality of drug product to the patient. In addition, quality risk management improves decision-making if a quality problem arises. It should include systematic processes designated to coordinate, facilitate and improve science-based decision-making with respect to risk. Approaches to quality risk management. The industry widely uses two approaches to risk management. Proactive. This approach identifies the threat exposure areas to mitigate the potential for loss before the loss occurs. Reactive. This approach investigates the threat exposure areas to identify the root cause for loss and its control after the loss occurs. Area of scope for quality risk management in the industry. There are a number of areas of opportunity where the potential risk could be managed. These include process, materials, facilities, manufacturing, distribution, patient. Renowned methods for managing of risks in the industry. Qualitative analysis is the action of using subjective information in determining a conclusion of a given unit without proper statistical outcome. Qualitative analysis is used for subjective decisions based on the non-quantifiable information. Generally, it is used during root cause analysis to come up with possible solutions. Quantitative analysis is structured statistical analysis to estimate the risk how much involved in the process/facility/system. Quantitative analysis is a statistical analysis and is a combination of severity, probability, and electability. Risk priority number, RPN, can be established during quantitative risk analysis and it is evolved by multiplication of identified values of severity, S, probability, P, and electability, D. The RPN rating scale can be established in three levels, i.e. low, medium and high, to estimate the identified risks are at which level. The image below provides an overview of a typical QRM process. Refer to ICHQ 9 for further understanding of each element which is involved in the structured QRM process. Basic risk management tools. The pharmaceutical industry and regulators can assess and manage the risks by using recognized management tools. Below is the non-exhaustive list of some of the tools. Failure Mode Effects Analysis, FMEA. Failure Mode, Effects and Criticality Analysis, FMECA. Fault Tree Analysis, FTA. Hazard Analysis and Critical Control Points, HACCP. Hazard Operability Analysis, HAZOP. Preliminary Hazard Analysis, PHA. Failure Mode Effective Analysis. FMEA is an effective tool for an evaluation of potential failure modes. It methodically breaks down the analysis of complex processes into manageable steps. FMEA can be used to prioritize risks and monitor the effectiveness of risk control activities. An overview of some of the most critical steps are as follows. Identify an area where risk exists. Describe the system and function. Create a block or process flow diagram indicating relationships within the process. Create a worksheet containing information about the system. What is important is that you have a process to analyze potential failure modes, i.e. problems that could happen, and the potential effects of that failure on your process. Let's elaborate on each specific step. Step 1. Selecting the high-risk process or area. You can identify the high-risk processes with the following criteria but not limited to: lengthy process with more stages, high risk of failures in the process, top failed product in the history, process that is heavily dependent on human intervention, process executed in the oldest facility, process or facility with rapid changes. Step 2. Forming the assessment team. The assessment team should have the following capabilities: subject matter expert, cross-functional, to cover all levels, solid understanding to the process being assessed, well experienced on the process being assessed, well qualified with strong analytical skills. Step 3. Diagram the process. The assessment team should have the following capabilities: subject matter expert, cross-functional, to cover all levels, solid understanding to the process being assessed, well experienced on the process being assessed, well qualified with strong analytical skills. Step 4. Identify the potential failure modes. Process can have multiple failure modes and each failure mode can have multiple effects. Address the following questions during failure modes identification. What could fail with this step? Failure modes. Why would this failure occur? Causes. What could happen if failure occurs? Effects. Step 5. Assess the failure modes and causes. Risk mitigation requires an understanding of the severity, probability and detectability of the exposure. Use clear scale for rating of risk consistently. Keep the scales simple and ensure they are appropriate to the exposure and organization's risk tolerance. Causes identification should be transparent to mitigate the risk effectively. Step 6. Assessment of critical failure modes. The highest RPNs should be focused on first and should be considered as critical. Ask the following questions during assessment. What might cause the failure to occur? When might the failure occur? Where might the failure occur? Why might the failure occur? Step 7. Pre-design the process. Considerations for the redesignation of the process. If identified the critical failure mode. If inadequate controls exists. If existing process not robust. Direct the redesignated process prior to its widespread implementation. Framework for failure mode effect analysis assesses the steps of the process and identify where the problems may occur. Identify consequences of each failure mode should it occur. Scores the exposures quantifiably. The highest RPNs should be focused on first. Assists with better understanding of the process. Brainstorming is the critical to the process. Concerns regarding QRM implementation. Hiding risks, writing half the truth, for example in an investigation report, a means of removing industry's obligation to comply with regulatory requirements. Both companies and inspectors have to think and not simply follow black and white rules. Conclusion. The use of a risk-based approach provides a consistent method for decision-making which was easily associated with resource allocation and ensuring patient safety. Ultimately, applying risk management to pharmaceutical industry should reduce the number of threats or minimize their impact through the consistent use of the tools/methods and periodic review. The output of the risk management supports to the organization to meet the defined goals. You're listening Farmer Knowledge audio tracks. Please subscribe and click bell icon for increase your farmer knowledge.